Briefly introduce our two speakers and then they'll take it away. We have Diana Feliz-Oliva. She has worked in the field of social services and public health for over 20 years and currently works at Gilead Sciences. Ms. Oliva has more than 15 years of experience working with transgender population, including HIV-positive individuals, sex workers, those with mental illness, substance users, homeless individuals, and incarcerated adults, youth, elderly, people of color, and undocumented individuals. An effective social advocate and role model, she has a specific interest in advancing the development of public policy that addresses community-level health and social problems. We also have with us today Ethan Alexander Patron. He is a transgender man of color who was born in Peru and immigrated to Los Angeles at the age of 12. His mission is to empower marginalized communities through social activism and leadership. He currently works for St. John's Well Child and Family Center as a patient advocate, where he connects local trans-identified individuals to the resources they need in order to thrive. His work focuses on advocating for patients that face obstacles with the medical aspect of their transition. Outside of work, Ethan serves as Mr. Pride LA 2017 for the Imperial Court, a 501c organization raising funds for educational scholarships and local organizations. Thank you.
All right, hello everyone. How are you doing today? Happy to see you here. Thank you for coming. My name is Ethan Patron. I do patient advocacy for St. John's Well Child and Family Center. So that means that I oversee the medical side of their transition of our patients. And I'm also a transgender man of color. My pronouns are he and him.
Good morning. Hopefully the morning opening session was wonderful and knowledgeable, and hopefully you received a lot of information. That's what this conference is about, making sure as providers or future providers, you are increased with awareness and knowledge in working with anybody from the LGBTQI+ to communities. Again, I'm Diana Feliz-Oliva, and I'm currently a community liaison for Gilead Sciences, which we are one of the catalysts and leaders for HIV medicines. But in my previous role, about 3 months ago, I was Ethan's boss at St. John's Well Child and Family Center. I was the program manager of the Transgender Health Service, which started about 4 years ago, with just a handful of patients. I believe we had about 6 to 9 patients. We opened our clinic in South Central Los Angeles on Slauson and Hoover. 4 years later, we have over 2,000 patients accessing hormone therapy, primary medical care, mental health services, dental services, victim advocacy, legal name change, social groups, support groups, so many services where basically, I'm no longer working at St. John's, but Ethan and St. John's is basically a one-stop shop where not only are you able to receive your medical care, but you're able to receive a whole slew of comprehensive health services. Okay? The model of the program, the medical model of St. John's and their transgender health program is based off of using the informed consent model of care. So our clinic does not require anybody seeing a mental health therapist in order to access hormone therapy. We use the informed consent model. We know that historically medical institutions have created barriers and challenges for people that were trans identified in accessing medical care. We wanted to make sure that we eliminated those barriers from the first appointment. So they have access to their medical provider on their first appointment, and if they sign and understand the informed consent form, they can go ahead and begin their gender identity with hormone therapy if that's their choice. So I'm really proud of the fact that we created a wonderful program in South Central Los Angeles and now in downtown. And it started with, the community coming to St. John's back in 2012, saying, hey, leaders of St. John's, you guys are seeing a handful of trans individuals for primary medical care. Why don't you develop a specialized trans program for the community members that are already here? And so with discussions and training and capacity building expertise from the Transgender Law Center, the LGBT Center, Children's Hospital, we were able to open the doors to trans individuals in 2014, January, with those 6 to 9 patients. So you're going to see in this presentation And of course, our title presentation is Getting It Covered, Expanding Access to Healthcare Insurance. Many of the barriers and challenges, even though we have a lot of benefits here in the state of California, is still troublesome for many individuals accessing healthcare. And so this presentation is kind of like our model of how we were able to kind of be more efficient and seamless and really creating those opportunities and eliminating those barriers and challenges for individuals.
All right, let's start. So what is ACA and why it's important? The Affordable Care Act, otherwise known as the ACA or Obamacare, as most of you know it, it's a healthcare reform act implemented in 2010, and it was designed to improve access to healthcare insurance for all U.S. citizens and qualifying residents. The goal is to reduce healthcare costs overall while adding more coverage for the public. Under Obamacare, all insurance plans must provide services in each of the 10 essential categories. And these include outpatient care, emergency room services, hospitalization, preventative care, wellness visits, chronic disease management, maternity newborn care, mental and behavioral health treatment, prescription drugs, services and devices to help people with injuries, disabilities, or chronic conditions, lab tests, and pediatric care. Under Obamacare, we were able to implement trans-affirming care for our transgender patients. Obamacare does cover hormone therapy. If that is something that you're interested in doing, that would be covered under Obamacare, under Medicare. Do you guys have any questions?
And just a real quick commentary. That's why it's hugely important as LGBTQI plus A2 individuals or allies or future medical providers or current medical providers that we continue to fight to keep the Affordable Care Act, especially now during these political times and this political administration where they're trying to eliminate even the word transgender from many of their federal agencies. We really want to make sure that we are conscious, we become activists, and we become allies for these community members to making sure, because prior to ACA, there was no benefits, no privileges for any of our LGBTQI folks. So we want to make sure that you remember that and that in your work that you incorporate some sort of activism to defend ACA.
So that was us for the Pride March last year. Currently, transgender and gender non-conforming people in Los Angeles are able to access trans-related medical services through Medi-Cal, and according to the California Endowment State of Trans Health, there was a study conducted in 2016. It has been found that at least 1,000 individuals in the county are accessing trans-related healthcare. However, if the ACA is repealed, many would lose their health insurance coverage and protections that shield them from facing discriminations, which ultimately can prevent them from accessing medical-related services. So it was 1,000 individuals back in 2016. Now we are seeing over 2,000 patients at St. John's that identify as trans or gender non-conforming. So as visibility increases, we are seeing more patients, which is really important because we're able to serve these sorry, I'm a little nervous. These populations. Sorry.
Also, there was another study, I think it was an LA County study or a federal study, and we kind of were able to calculate based on LA County. There's about roughly, at the very minimum, about 24,000 individuals who identify as trans in LA County. This particular report by the California Endowment said there was about 1,000 individuals accessing trans-related care. But keep in mind, it doesn't sometimes account for the most underserved, impoverished trans communities, which may be homeless, may be transient, and especially may be undocumented. So I would say that we have, more than 10,000 people accessing trans care with St. John's, with the LA LGBT Center, Children's Hospital, Kaiser Permanente, and any private physicians that are out there serving the community. Okay, some of the, no, you're the insurance expert.
So we have two different types of insurance, which are PPO, and this type of insurance has open access to healthcare providers in and out of network. You can see a doctor or a specialist you'd like without having to see a PCP first, and PCP stands for primary care provider. And premiums tend to be higher, and it's common for there to be a deductible. And HMO is limited patient care and only access doctors assigned to them. So it gives you access to certain doctors and hospitals within its network, and there are more restrictions for coverage than other plans, such as allowing only a certain amount of visits, tests, or treatments. So the main difference between the two is that with PPO, you are able to see a provider without having to be referred by your doctor, whereas HMO, you have to be referred by your primary care physician to be seen by a specialist. So, for instance, if you're a transgender patient and you want to see someone for trans-affirming surgery, then under PPO, you wouldn't necessarily have to have a referral, but under HMO, you would need your provider to refer you.
Let me quickly add that with HMO, which is probably the majority of the population here in Los Angeles that are receiving HMO Medi-Cal services, it's very limited as far as what surgeons actually want to perform surgeries for people who have HMOs. We are having a struggle for the last several years here in Los Angeles County to identify surgeons in LA that are willing to accept Medi-Cal patients. We all know that Medi-Cal, or if we don't know, Medi-Cal pays low, right? It's a free public health insurance. If I went to school for cosmetic surgery, I want to make sure that I'm charging all these Beverly Hills housewives as much as possible, right? I'm not going to really care for the Medi-Cal poor community. I may not even distinguish, every year there's going to be a percentage of my work really going to the underserved population like Medi-Cal recipients. So it's been really difficult to identify surgeons here in Los Angeles willing to accept patients who have HMO Medi-Cal services. And so unfortunately, many of our trans men who are contemplating top surgery, the double mastectomy, sometimes they have to go to San Francisco to Dr. Satterwhite or Dr. Crane in order for those surgeries to happen. Fortunately now, with the work and the advocacy work of Ethan and St. John's, and in conjunction and collaboration with the Transgender Health Program within LA Care, which is the Medi-Cal program here in Los Angeles, we've been able to identify additional surgeons. Now we have Dr. Alexander Sinclair here in Beverly Hills, and then also the Krager brothers in Thousand Oaks, and Dr. Maurice Garcia at Cedars-Sinai, who will be speaking at the next track, and Dr. Scott Mosser. Okay, so there's only a handful of folks actually opening their doors to trans folks who have HMO Medi-Cal services.
Medi-Cal. So if you qualify, if your income is below the 138% poverty line. If you are approved for Medi-Cal, you get your healthcare coverage through a managed care program. Having Medi-Cal through a managed care program means that you have a primary care physician and you see who you see for most of your health needs. So this would be your doctor. And when you see a specialist, or you can also have your test done, you usually have to get a referral from your primary care physician. So as I was saying earlier, if you do have Medi-Cal, which is right now for Los Angeles, is really great to have because it allows you to have transgender affirming surgeries, and also it covers hormone therapy. And it does cover, and you can be referred outside of LA too if the doctors do want to contract with your plan. For Medicare, turning 65 is one way you can be eligible for Medicare. You can be under 65 years old and still qualify for Medicare because you are receiving Social Security Disability Insurance, or SSDI. And it covers inpatient hospital care, skilled nursing facilities, hospice, lab tests, surgeries, and home health care. So under Medi-Cal, we have different insurances. For instance, we have LA Care, we have Anthem Blue Cross, we have HealthNet, And these are the majority of the insurances that I do work with and refer our patients to if they wanted to be referred out for surgery. And as of 2018, we have been able to successfully refer at St. John's about 30 patients, and all have been approved for their surgeries. My Health LA is a county program that provides primary health services for undocumented and non-resident recipients. There is no cost to apply to My Health LA. Ongoing and primary and health services, prescription medicine laboratories, services and tests, and other related healthcare services are covered. Hormone therapy is covered under My Health LA, however, surgeries are not. And this is because it's not an insurance, this is more like a county program. And we do offer it at St. John's. If you don't have insurance, you can be seen by us. And you'll have your doctor visits, you'll have your lab tests, and you'll also have access to your hormone therapy.
How will insurance improve my hormone therapy? So as a trans individual or a patient, in order for insurance to approve a member's claim, a pre-authorization must be submitted by the Medi-Cal or the medical provider. Who's familiar with a pre-authorization claim in this room? Just a few folks, right? Well, trust me, as future providers, you're going to be really familiar with pre-authorization forms, especially if we continue to go down the road we are, where we're going to be taking away some of the services. We're going to be more prone to go ahead and file pre-authorization claims. Also, a pre-authorization request can be done online or through the phone, and then in most cases, a letter from a therapist is not required for a member to have hormone therapy coverage. And if the patient is under 18, a legal guardian must inform consent for patient to begin hormone therapy. And so, unfortunately, still here in the state of California, even though we're really progressive and we have laws that protect trans individuals, health insurance laws still demand a pre-authorization for hormone therapy. And we have to do pre-authorization claims or requests every 3 months for the most part for our patients. Because that's when the hormone therapy vial, the bottle, runs out. So every 3 months, Ethan Patron has the fortune to file these pre-authorization claims. So we actually hired, back in those days, a full-time employee, like our patient advocate, to go ahead and complete pre-authorizations, because it's a full-time job completing pre-authorizations for 2,000 patients every 3 months. We're finally now, I think last year we started seeing LA Care and some other programs doing 1 year approvals, and some we even saw that there were some lifelong approvals. And that's the key, and that's the direction that we want to go as California residents, is making sure that we provide lifelong therapy for hormones, and there doesn't need to be a person that we need to hire full-time just to file these claims. It's like diabetes. You're not going to have the diabetic person renew their prescription every 3 months and having the person at the clinic there do the claims. We know the person is diabetic, they may need it lifelong, or hypertension, or any other medical conditions. And so we want to make sure that our legislators and our politicians in Sacramento understand that, and so hopefully the laws will change eventually where hormone therapy is a lifelong approval, and no one needs to complete pre-authorization requests every 3 months. Okay. What is covered for insured recipients who choose to medically transition? Okay, so some of the opportunities for individuals is hormone therapy. The key hormone for male to female and or trans feminine folks is estrogen and androgen blockers. And then also the key hormone for female to male and or trans masculine folks is testosterone. And there's different types of hormones, and Ethan's going to go ahead and explain the different 5 possible ways to administer the female hormone.
So for trans feminine and male to female patients, we have estrogen and androgen blockers, otherwise known as Spiro. And for the estrogen, we have 5 ways to administer that. We have the estrogen pills. We also have the estrogen vials. We have the estrogen patch. We have a cream and also pellets that you put into your skin every 3 months. And you have to change it every 3 months. And then for female to male transmasculine patients, we have testosterone, and you can either inject that subcutaneously or intramuscularly. And we also have a cream that you apply every day for your therapy.
Okay, so some of the gender-affirming surgeries that are possible are the breast augmentation, chest reconstruction, vaginoplasty, phalloplasty, medioplasty. Oh no, I'm sorry, I'm gonna say that wrong. Metodioplasty, tracheal shave, and facial feminization surgeries may be covered on a case-by-case basis. So, does everybody know what vaginoplasty is? Right? Okay. Phalloplasty and the metodioplasty. No? Okay. Ethan will explain.
So a metodioplasty is a bottom surgery. It's similar to a phalloplasty, but it's not. The surgery does not require many steps. It can be done in one surgery, and it's it's a different type of bottom surgery for transmasculine folks, where they create a penis from your already from your anatomy, I guess. And then we have phalloplasty, which can be done in 2 to 3 stages, sometimes 4. And we do have surgeons that I've referred patients to under Medica who have gotten their phalloplasty in LA. So, do you have any questions? No. If I'm HIV positive, can I access these services? If the patient wants to start hormone therapy, they can, as it possesses no HIV-related risks. In a small percentage of patients, there may be complications such as allergies or extenuating circumstances on a case-by-case basis. So if you are HIV positive, yes, you can have access to the services, and this includes hormone therapy and trans-affirming surgeries.
With the HIV positive population, because if you don't know by now, trans women of color specifically are disproportionately impacted by HIV and many, many other situations. And so it's not unfamiliar that a surgeon may have a trans woman who wants vaginoplasty or breast augmentation and may be positive. So as long as they're in treatment for their HIV and they are virally suppressed or undetectable, copies below 50 or sometimes 40, and then they would be a good candidate, other than making sure that their overall health and there's nothing else that will impede any complications during the surgery, like obesity or somebody that's a current smoker. Okay. For tracheal shaving, it's the shaving of the Adam's apple, and facial feminization can mean shaving some of the eyebrow bow, your jawline, your chin, your nose. You know, there's many, many facets to facial feminization. Okay. Yes. For vaginoplasty, it's anywhere from $25,000 on up. For phalloplasty, it's $75,000 out of pocket, and for facial feminization, I would say it's anywhere from like $15,000 to $25,000. And hormone therapy, I'll give you the most expensive scenario, and that's the pellet form. When I transitioned almost 15 years ago, I sought a private doctor and I paid out of pocket. And each pellet cost, I think it was like $120. And they can put up to about 12 pellets in me at any given time every 3 to 4 months. And so they would make an incision in your buttocks here, and they're like little mini thins. And they'll place about 10 to 12 of them if you want the aggressive therapy. And you calculate, you know, and then the doctor's visit, of course, his charge. So it came out to about almost $2,000 every 3 to 4 months. So it's a very expensive process to either feminize or masculinize, depending on your gender. And so a lot of people will ponder and wonder, why do trans women of color are always sex working? Now you know why that some of them have to engage in survival sex work, not only to put a roof over their head and food on the tables and clothes on their back, but to feminize, to start hormones, if you don't qualify for My Health LA or for Medi-Cal, and then you're going to have to pay out of pocket. And so trans women of color will resort to sex work either on the streets, usually on Santa Monica Boulevard or certain pockets of poor neighborhoods, or now on the internet. And if you haven't gone through Craigslist yet, who has not familiar with Craigslist? Okay, I think everybody try to buy a car, try to buy something, right? You can even try to buy entertainment, right? Adult erotic entertainment. And so there's a section there where you can hire strippers, you can hire escorts. There's a lot of websites, My Redbook, My Backpage, Eros. You know, so many websites are now geared towards escorts, you know, and usually trans women will fall into sex work because the process to feminize and to transition is so expensive. And sometimes they don't want to rely on Medi-Cal services. They want to see the best doctor. And one of the best doctors is world-renowned Marcy Bowers, right, near Palo Alto. And then also the doctors that we have in Thailand. Many of them will fly from here. Actually, one of our patients, she got a second mortgage on her house, flew to Thailand, and had her vaginoplasty, and had her tracheal shaved, and she had her facial feminization. And I think it all came out to like about 50 or 60,000. And so it's a very expensive process for both trans women and trans men. Okay.
So how long does it take for the insurance to approve my claim? All insurances process claims differently. Some may be faster than others, however, there is no specific time set. The time frame heavily depends on whether the member whether the member has all the documents needed for submission and if a referral has been issued by the medical provider. Patience is key, don't lose hope. So yeah, if you have Medi-Cal and you are trying to access hormones or therapy or surgeries, it will take a little longer just because it has to go through the approval stage. It has to be reviewed by medical providers at Medi-Cal, and if they believe that you are qualified for the surgery, then it will be approved. The turnaround time for Medi-Cal patients usually is anywhere from 3 to 4 weeks now, which is better than before because it used to take up to 5 months for just the approval consultation. So it does take a little bit, but I've been fortunate enough to have the submission sent to the insurances approved.
And Ethan just described the progress we've made in the last year of getting approvals and kind of expediting some of the processes for the patients. When I started St. John's 2.5 years ago, that wasn't the case. Medi-Cal companies or health insurance carriers were telling us, tell the patients it's going to take 1.5 to 2 years. And so we had to be really realistic to our patients and say, and kind of share those bad news, saying, you know what, the health insurance carriers are telling us to tell you guys it's going to take about 1.5 to 2 years. So as a future medical providers, you know, I think one of the key things is just always be open and honest and set real life expectations for many of the patients so they don't have any disappointments because they're going through gender dysphoria, body images, and then if you're a provider or future provider that is just not open and honest and real and set real expectations, you may lose your patients.
How do I contact my insurance regarding my claim? You may contact your insurance by dialing the number provided in your card. If you are a patient of St. John's, you may call the patient advocate, me, who will follow up with the insurance and take the necessary steps for your claim to be approved. So this is why it's important, as Diana was saying earlier, to have patient advocates in your institutions to take care of the claims, because sometimes it's confusing. It takes a long time to get a hold of someone on the other side, and sometimes patients just don't go through through their hormones, or they don't get their hormones because they don't know where to begin. So that's why it's important to advocate for them and follow up with the patient advocate, which is me. So if you want to contact your insurance, either if you're a patient, you can contact me, or you can also look in your insurance card for information.
I can't, how would I say, accentuate enough that having, if you're going to be a future provider, having somebody on and you're going to go into trans specialty care, having a patient advocate like Ethan, hiring a patient advocate full-time that represents the community that you're going to be serving, or having staff in general in your clinical practice that's going to be reflective of the community you currently serve. We're living right now in the age of federally qualified health centers, right? I call this age the health industrial complex, very similar to the prison industrial complex. We have health centers springing up in almost every health district in Los Angeles, and every medical provider in those federally qualified health centers, even St. John's, are required to see 20 patients minimum, as their federally qualified health status is in jeopardy if they see less than 20. So they have to see patients. Now imagine you're working an 8-hour shift and you see 20 patients. How much time does that allow you for each individual? Not much. And sometimes when you finally have a gender-affirming medical provider, as a trans patient, sometimes you're going to share a lot because you've never had a space to share before, because every medical practice before that has been shunned or rejected because of your gender identity. We have people coming to St. John's, which is our clinic is now in downtown by Adams and Figueroa, but we have people coming from San Bernardino, Barstow, Fresno, Santa Barbara, Riverside, these 4 counties near us, because there's no qualified gender-affirming medical provider in their area, and they have to travel over an hour and a half to get to us, sometimes over 2 hours. And so it's really important during these days is making sure that if you're going to be a future provider in a few years, making sure that there's someone in your staff that can handle not only the pre-authorization claims, but can kind of talk to the patient one-on-one, because as a medical provider, you may not have the time because you're mandated to see X number of patients. So you want to make sure you have somebody in your staff can give that one-on-one personal touch. Okay.
I have been approved or denied. What is the next step? For hormone therapy approval or denial, if your claim has been approved, your pharmacy of choice will be able to process your medication, and they will contact you when it's ready for pickup. If your claim has been denied, you may be able to appeal it by submitting an appeal letter explaining why your medication is necessary for your well-being. Sometimes it helps to have a provider letter attached to speed up the process. So this is very important, because for a lot of us, it's necessary to have our hormones and to be who we are, right? If your insurance is not approving it because it's not necessary, then you have to have your medical provider vouch for you that it is. We are trying to eliminate this as much as we can and working towards a future where we no longer have to prove that we need this, the hormone therapy for us. Hopefully that does happen in the future. As Diana was saying, now for LA Care, we have been getting the approvals for about a year and sometimes lifetime. But for other insurances, we do have to have the approvals renewal every 3 months. For gender-affirming surgeries, approval or denial, if you are looking for a trans-related surgery and you submit your claim, you will be contacted by your insurance via USPS or the mail. In your letter of approval, there will be a time frame to set up a consultation with your surgeon. Once the patient has gone to the appointment, the insurance will issue a second letter of approval for the actual surgery. The patient will then be contacted by the surgeon staff setting up a time and a date for the final surgery. Sometimes insurances will deny claims due to believing that the surgeries are cosmetic. So when this happens, it's essential for the patient or patient advocate to contact the claim department to appeal the denial. So yeah, if you are looking for a gender-affirming surgery, then you are going to have a letter of recommendation from a licensed behavioral psychologist. And this is because you want to advocate that you're following the WPATH guidelines, and it indicates that you do have gender dysphoria, and it's not cosmetic, that it's actually medically necessary for you to have these surgeries. How can insurance cover my surgery? Some insurances will cover trans-related surgeries. These steps must be followed before submitting a pre-authorization request. A letter from a licensed clinician is needed for any surgery above the waist. So if we're looking at chest reconstruction, breast augmentation, facial feminization, trachea shave, then you will need one letter. And the letter must follow WPATH guidelines and specify which surgery the patient is requesting. If the patient is seeking genital reconstruction surgeries, then 2 letters are required from 2 different licensed clinicians. And then a letter from a medical provider must be submitted along with a therapist's letter. This letter includes medical history and length of the time that the provider has been caring for the patient. Having these letters will allow insurances deem the surgeries as medically necessary rather than cosmetic. And once the patient has obtained them, they will also be able to submit them to the insurance for pre-authorization request. At St. John's, the patient advocate will be in charge of gathering the necessary documents that will ensure approval of request. So yeah, if you are looking for any surgery above your waist, then you will need 1 letter. And for bottom surgeries, you do need 2 letters from 2 different clinicians that are licensed. And so at St. John's, I will be in charge of doing these referrals. And yeah, but if you do have a PPO plan, you don't need a referral. You can just go see the provider of your choice with your mental health letter, but you don't need a referral. Under Medi-Cal, you will need a referral for your surgery request.
Does everybody know what WPATH stands for? Okay, so maybe 1, 2 people. World Professional Association for Transgender Health. You might want to research that website. The WPATH are guidelines. They're not policies, they're not procedures, they're not the Bible. They are just guidelines to help providers and surgeons with trans health care. So some surgeons or medical providers follow the guidelines to a T, some don't. Years ago when I did my breast augmentation, well, I didn't have to submit no pre-authorization. I didn't have to see a patient advocate. I didn't have to see my clinic. What got my breast augmentation approved was cold, hard cash. They didn't do no physical evaluation. They didn't do any blood tests. They just said, it's $3,500. Thank you, Miss Oliva. You're out the door. Okay, so sometimes surgeons, some of them will follow the WPATH guidelines and some won't. And so sometimes this procedure is very daunting and intimidating for folks, especially if you lack education or medical knowledge. Sometimes going through, we call these the hoops, having trans people go through the hoops, seeing a medical provider, getting a letter, seeing 2 different clinicians if they want a vaginoplasty, which are all equally important, of course. But for a person who mistrusts the medical community, having many name checks, many pokes, sometimes is very intimidating for folks. So then they rely on their own cash to go ahead and get some of these surgeries performed. Or, inject themselves with silicone on their own in order to forego all this whole process. Okay. So common types of gender-affirming surgeries are the chest reconstruction surgery for transmasculine folks. It is fairly common for patients that identify as female to male or transmasculine to want chest reconstruction surgery, otherwise known as top surgery. Keyhole and double incision with nipple grafts are the most common types of top surgery. Has anyone gone on the internet and seen a result of transmasculine top surgery? Yes, a couple of people. Okay, so I would encourage you to kind of go on the internet and look at the procedures. We actually had a video, but we had trouble in our last presentation kind of playing it, so we eliminated the videos. But basically, double mastectomy, where the breast tissue is surgically removed, and construct a male chest appearance. For trans women or trans feminine folks, we have the breast augmentation as a possibility. So many of the techniques used for breast augmentation are the same as traditional breast augmentation for cisgender patients. Okay. And of course, they have the option of saline, silicone, or mammary gel.
Male to female or trans feminine bottom surgeries. Vaginoplasty is the genital reconstruction where the vagina is formed from the penis. The surgery is covered for patients under medical and most private insurances. I know that for the patients that we do refer from St. John's, the insurance does want you to be on hormones for at least 1 year before we can go ahead and submit the claim for bottom surgery. An orchiectomy is the medical term for the surgical procedure to remove one or more of the testicles for male to female patients. This surgery is covered under medical and most private insurances as well. And then after bottom surgeries or transmasculine, we have the hysterectomy, which is the removal of reproductive organs for people that were assigned female at birth, which includes the cervix and the uterus. Metoidoplasty generally involves releasing hormonally enlarged clitoris. Utheroplasty, the lengthening of the urethra to the tip of the phallus, and covering the phallus with a neighboring skin. It may be combined with a vaginectomy and scrotoplasty. And then we have phalloplasty, which is the reconstruction of a phallus using skin grafts from a donor site. It's the most common phalloplasty. I know that they're improving the surgery, and I believe one doctor in New York is applying the technique of not using a donor site anymore. So phalloplasties are becoming more common as surgical techniques improve. And they're becoming more common with our patients as well. It was something that I didn't see when I started working at St. John's, but now that we have a provider in Los Angeles that does perform phalloplasties, I am seeing more requests for this, and it is covered under Medi-Cal and LA Care, and also private insurance. So this concludes our presentation. Thank you.
I know we went through it really quickly. We would like to open it up for any questions that you may have as future providers or any community members. If you want to contact us individually, Ethan Patron's email is there, mine as well. But are there any questions? Yes?
You apply at St. John's. So it was a program created for the transgender health program. It was actually a grant under the California Endowment. But if you want to become a patient advocate, then when you're working at a medical facility, then you would open that opportunity to the provider and advocate for that position, because I'm not sure that it's open in other medical facilities besides St. John's.
Yeah, Usually, federally qualified health centers are very responsible of making sure that they hire people from the community, of course, right? But then also having either a patient navigator or patient advocate, but having someone on your staff full-time to handle this, because sometimes your medical assistant or someone else may have the brunt of the responsibility, and sometimes a little bit overwhelming, because when you're dealing with a trans individual, us trans folks, we want it yesterday. And we're going to be coming to your office and to your desk, screaming and hollering until the referral is done, until we get our letters from the surgeons and making our appointments and all that. It's a little bit frustrating because imagine, and I always give this example in training, imagine you are born in South Central Los Angeles, right, where most of our patients come from. And you're a person of color, so that's one strike. You're in South Central, another strike. You happen to be trans-identified, another strike. You have no transportation to get to your medical appointments. So you live in Compton. You were born Andre, but you want to be Andrea. But every morning, you have to get up and you look at your body physically in a mirror while nude. That might come up many gender dysphoria body image issues right from the morning. You haven't even had your breakfast. You get ready because you have an appointment to see Ethan at St. John's to talk about surgery possibilities and referrals. So Andrea gets up, has to deal with family that's not supportive. They might call them a freak, a faggot, whatever. When are you going to get out of my house? You know, my religious views and beliefs don't support this. You're going to hell. We've heard it all. And so we get up, we get dressed in the appearance and the expression that we prefer. Okay, so Andrea puts on her wig, puts on her makeup, puts on a skirt, some shoes, and she walks out the door. She's walking to her bus stop because she has to catch several buses to get to St. John's because we're downtown. At the bus stop, someone says something. Oh, that's a dude. That's a man. And they spit at her. She wipes it off. She gets on the bus. Somebody, a couple of guys, a couple of high school guys, are on the bus. They stop mocking and insulting and just, a slew of derogatory terms. And she has to endure that, for several bus rides. Finally, she gets to St. John's. And on her way from the bus stop to St. John's doors, somebody kicks her. So then she's coming into St. John's demoralized, beaten, not only physically, but emotionally, and everything, in any capacity. And they come to St. John's, and it's important to have somebody from the community, or somebody, at the very least, an ally and empathetic to trans individuals, to help with the process of navigating your transition process. And so sometimes you may just need to comfort, hug, hold, share a word of encouragement or understanding, because sometimes there's so many problems out there for trans individuals, and that you as medical providers, you're only kind of very, you use a different lens that is just very medical model. Get my patients in, let me serve them, move on to the next, But sometimes you need to hire somebody within your office that will do the tender, loving care, so to speak, and making sure that there's somebody on the other side of the desk that looks like them, sounds like them, dresses like them, has the similar background experience. It's hugely important. So as future providers, making sure that you are trained to provide empathy and understanding and increase your awareness of the struggles that many trans people have to go through just to receive medical care. And that's just medical care, but then can you imagine the things that we have to endure when we're at a movie theater, or we're at a public restaurant, or we're at a bus stop, for that matter. And so keep that in mind when you, as future providers, making sure that whatever space that you work in, making sure that you carve out and create affirming, safe environments that are secure for trans individuals, and making sure your staff is culturally competent and practice those skills and practice cultural humility, and then making sure that you hire staff that reflects the community you're serving. So if you're going to go into trans healthcare and you're going to have a slew of trans patients, making sure 1 or 2 individuals in your healthcare center is trans identified. Okay? Any other questions? Yes.
So with the repeal of the individual mandate for the ACA and just like general attacks on the ACA, what is like the backup plan then for like trans people to access like trans-related healthcare? Because like part of the ACA is like you have to like offer these services for your insurances, so that's taken away. Is it just like you need to pay money then? Like, is there a backup option then?
Yeah, unfortunately, there's not a backup option if ACA is taken away. However, the State Department of Health has professed that whether ACA is repealed or monies are taken away from the state of California, California will generate revenues either by increased taxes to making sure that we still have universal health care coverage in the state of California. And then I'm sure LA County, the Board of Supervisors, will also probably include a county tax and making sure that the current health programs that we currently have are still accessible if, for whatever reason, the federal government eliminates some of our federal money to keep the state of California. Yes?
So actually, according to the California State Insurance Commission, there's IGNA, Insurance Gender Non-Discrimination Act of 2006, that states that all insurances, including Medi-Cal and Medicare, that operates here in California has to cover gender transition, including hormone replacement therapy, all gender-affirming surgeries, and therapy, regardless of what happens to the ACA. So even if the ACA, that law is taken away by the HHS, because LA Care, CalOptima, Medi-Cal operates in California, it has to remain covered due to the State Insurance Commission laws.
Wonderful. Thank you for that. Any other questions? Yes? So for the first 3.5 years, we had the director of the Transgender Health Program, Lyle Cook, who's a physician assistant, treating over 2,000 patients. I think we probably now have close to 2,500 patients, or you all have 2,500. So then about 6 months ago, St. John's hired MD, Dr. Sushant Vanderpali, who now works at the Trans Clinic on 23rd Street. And so he sees, he doesn't only solely see trans patients, he actually sees the majority of his patients are actually cisgender, and he incorporates trans patients on his template and does not only hormone therapy for trans specialty services, but also anybody that has HIV or HIV prevention care, like HIV treatment medicines or prevention medicines such as Truvada for PrEP. So now we have 2 full-time medical providers seeing the 2,500 patients that St. John's currently has. When I started 2.5 years ago managing the program, we had about 300 patients, and we had Keck, or Lyle Cook, as our main medical provider, but he was only seeing patients Wednesdays and Fridays and half days. And I kept telling the senior managers of St. John's, say, you know what, now that I'm here at St. John's and I'm a trans Latina who happens to be bilingual, trust me, a lot of the trans Latinas from South LA and from LA in general are going to start coming, because once you find out that somebody's employed that looks like you, talks like you, has similar cultural background, people are going to like, oh, you know, there's a new manager and she happens to be trans and she's Latina and she's bilingual. She speaks our language. Let's go, you know. And so we've been able to increase our 300 patients to over 2,000 in 2 years, just because St. John's was adamant in hiring people that reflected the community. And so I advocated and screamed and hollered at my president and COO and said, we need Keck to be a full-time medical provider only for trans individuals, and it can no longer be Wednesdays and Fridays, it has to be Monday through Saturdays. And so finally we have now trans services Monday through Saturday, and we have 2 medical providers, Dr. Sushant Vanderpali and then also Lyle Cook. Okay. And then we have 8 staff members of the Transgender Health Program. So we have multiple grants. We have a federal grant, the SAMHSA grant. Everybody's heard of the SAMHSA, SAMHSA, Substance Abuse Mental Health Services Administration. They give federal grants to agencies. And so we received a grant to treat or address the high risk of HIV and substance use within trans women of color population. So with that grant, we were able to hire 4 individuals. And then we have a state of California governor's grant for victim advocacy. So anybody, and if you don't know the statistics here in the California, over 66% of trans women of color have been assaulted physically in the last 2 years. And so the state of California gave us a grant to do victim advocacy, where we address our patients who come in through the door who said that they were robbed or they were beaten, they were involved in intimate partner violence, they were sexually or physically assaulted in the streets. Now we have services and a case manager to deal and provide, assistance with police reports or accompany them to legal proceedings or filing any assistance for financial assistance. And then we have a person that does legal name change and gender marker changes. And then we have somebody there that helps people with economic empowerment opportunities. So helps people set up a resume or build a resume, go through interviewing techniques or skills, do job placement, secure employers who are trans affirming, and making sure we pair up people that are seeking employment opportunities with these trans affirming employers. So we have a slew of services at St. John's. So it really takes a whole team. So we have 8 frontline staff members, and then 1 program manager, and then the director of the Trans Health Program, which is our medical provider, and then we have in addition another medical provider. So we have a slew of, I think, 10 individuals that really focus on trans care each and every day at St. John's.